Hello, and welcome to the Congressional Hispanic Caucus Institute's 2022 Graduate Fellowship Program Capitol Hill Briefing Series. I'm Marco Davis, President and CEO of CHCI. This series is the culmination of CHCI's premier 9-month graduate fellowship program, which offers exceptional emerging Hispanic leaders unparalleled hands-on experience in public policy. This unique fellowship program seeks to enhance participants' leadership abilities, strengthen their professional skills, and increase the presence of Latinos in public policy areas, most notably in the areas of health, technology, housing, energy, social equity, child welfare, and education. CHCI is thrilled to be able to offer our graduate fellows the opportunity to share their perspectives on policy issues that they're passionate about and convene leaders in this work for an informative conversation. Now, we'd like to thank our Graduate Fellowship Program sponsors for supporting the program, including Facebook, the PepsiCo Foundation, America's Health Insurance Plans, BBVA, Casey Family Programs, the Walton Family Foundation, the American Petroleum Institute, DaVita, Wells Fargo, and CVS Health. You can keep today's conversation going by using the hashtag CHCI Fellows on social media. And please visit chci.org to learn more about our graduate fellowship program, as well as our other leadership programs and special events. And we encourage you to reach out to our fellows via LinkedIn to find out more about their policy work and help them connect with job opportunities for when the program concludes in May. Now let's get to the briefing. Enjoy the discussion.
Hello, my name is Caroline Gonzalez-Scott, Vice President of Programs at CHCI. Join me in welcoming Congressman Adam Schiff from California's 28th Congressional District.
Hello, I'm Congressman Adam Schiff, and I would like to welcome all of you tuning in to today's Congressional Hispanic Caucus Institute policy briefing on culturally responsive child welfare practices and Hispanic children in foster care. I'm so proud of our wonderful CHCI Child Welfare Graduate Fellow, Aaron Campos, who will be moderating this discussion today. For the last 7 months, Aaron has worked on an array of issues related to children and families, particularly those who encounter the child welfare system. She is a passionate advocate for equity and cultural responsiveness in the child welfare system and has provided invaluable insight to my legislative team. We are so grateful to have her, and I hope you all enjoy her wisdom and leadership today. Thank you, and good luck, Aaron.
Thank you, Congressman Schiff, for your thoughtful introduction and commitment to children and families. As mentioned, my name is Aaron Campos, pronouns she, her, and I am the 2022 CHCI Child Welfare Graduate Fellow. I am excited to moderate today's policy briefing entitled Culturally Responsive Child Welfare Practices, Hispanic Children in Foster Care, featuring 3 highly qualified panelists with direct practice and system-level experiences with Hispanic children and families interacting with the child welfare system. For the purposes of this discussion today, I will use the term Hispanic to indicate children and families whose primary language is Spanish, and to also indicate children and families whose heritage comes from Latin America. The term Hispanic is used most often in the literature referenced in my briefing when referring to children and families from Latin America. However, I acknowledge that Latinos belong to culturally diverse backgrounds, nationalities, and languages that may not fit in this category. Child welfare systems operate at state and local levels to prevent and respond to child abuse and neglect. Federal legislation in recent years, such as the Family First Prevention and Services Act, has signaled a paradigm shift in child welfare practice from intervention to prevention. The Family First Prevention and Services Act provides funding for states to implement time-limited services for mental health, substance use, and in-home support services for families with children at risk of entering foster care. The idea behind this legislation is, how can we support the whole family and reduce the need for foster care? Family separation, or the process of removing a child from their primary caregiver, can have adverse effects on a child's development, including physiological changes, regression, sleep disturbance, and increased distress. For these reasons, child welfare systems only remove children from their homes when serious risks of abuse and neglect are present. The goal is always to move children into permanency, and this permanency is preferred to be achieved with a primary caregiver, but can also occur with a relative, and finally, a foster family. The number of children in foster care as of September 30th, 2019 was recorded at 423,997. Of the children in care on this date, over half were non-white children of color, with 21% representing Hispanic children. Hispanic families who are assigned case plans to reunify with their children face barriers to reunification, such as child welfare bias, language access, and for some families, legal challenges due to their immigration status. The timeline enacted by the Adoption and Safe Families Act of 1997 is uninformed of the barriers some Hispanic families face when striving to reunify with their children. 1 in 4 children in the United States has an immigrant parent, and 5 million children live in mixed status families where at least one parent does not have legal status. This increases the amount of systems involved in a mixed status family's case, which may include federal government agencies and foreign consulates. Today's conversation will start at the direct practice level to acknowledge the present barriers Hispanic families face when seeking to reunify with their children. Following this, we will pay close attention to families with immigrant members and review recommendations for child welfare agencies to better address these families' needs. And finally, we will round out the conversation by reviewing existing models of child welfare practice that integrate immigration-related legal services for families existing at the intersection of immigration and child welfare. Our first panelist is Maria Nuno. Maria Nuno is a bilingual, bicultural social worker who has been providing direct services to youth and families for the past 27 years within the public, private, and nonprofit sectors. The past 15 years, while at Casey Family Programs in the San Diego field office, she has had an emphasis in serving Spanish-speaking clients in her various social worker roles, and now as a family engagement liaison. Maria, can you speak to the barriers Hispanic families face when participating in their reunification case plans?
Yes, thank you, Erin. Good afternoon. My name is Maria Nuno. I have been providing direct services to Hispanic families throughout my social work career, and specifically, as mentioned, in the last 15 years as a social worker, and now as a family engagement liaison with Casey Family Programs, the nation's largest operating foundation on safely reducing the need for foster care in the United States, with our mission being to provide, improve, and ultimately to prevent the need for foster care. In my professional experience, the 4 main barriers that I have seen Hispanic families face in their efforts to reunify with their children are first and foremost language barrier. Hispanic families refer to our offices by local jurisdictions in support of reunification efforts, in particular to our office in San Diego, California, one of 9 community-based offices providing direct services to youth and families, tends to be primarily monolingual Spanish, immigrant, or first generation. They often lack the ability to understand the written materials provided to them, even when provided in Spanish, given the vocabulary and terms used, in addition to some being illiterate. They require translation and interpretation supports. Their inability to communicate with their caseworkers can lead to inaccurate assessments of problems and needs, which can ultimately influence decision-making. Secondly, in not being assigned a bilingual bicultural caseworker who can utilize a cultural lens and provide culturally responsive supports by first conducting a thorough assessment of the family's strengths, needs, trauma, family history, and devoting time in building a trusting relationship via honoring the traditional cultural values of personalismo and respeto, formal friendliness and respect, and of having a reasonable sized caseload permitting the substantial amount of time required in informing and educating on the requirements of the family's case plan, along with modeling and coaching in accessing community services. At Casey, social workers carry no more than 12 cases, making this possible. Thirdly, accessing culturally responsive community services. Hispanic families, in particular immigrant families or families living in mixed status households, lack the information and resources in reunifying with their children. They live isolated and almost hidden in their homes, reluctant to participate in civic life due to the fear of exposure or deportation, due to the social political environment and increased immigration enforcement, forcing family separations, even when their children are entitled to services. When their children are removed, they usually experience feelings of sadness, frustration, fear, and lack the knowledge in accessing services and organizational skills necessary in planning for those services. They require a caseworker to provide coaching, modeling, and advocacy in accessing them, which are oftentimes limited to the lack of service providers in their language, along with long wait lists, especially if mental health and chemical dependency services are needed. Also, due to the immigrant status, most don't qualify for specific funding, such as Medicaid, income assistance, and housing supports. This becomes a critical factor in meeting the reunification timeline, better known as ASFA, the Adoption as Safe Families Act of 1997, which places a timeline of 15 to 22 months in completing their case plan. In my experience, families referred to us for supports would be anywhere from 4 to close to 12 months into their case plans and not yet started them. They required urgent and relentless active efforts in identifying culturally responsive community agencies that could help meet their case plan goals. I would strive to connect them to Spanish-speaking personnel whenever possible, in addition to accompanying them to their initial appointments and court hearings, as well as serving as a translator as needed. In addition, I would advocate for financial supports in meeting material hardships, as in securing housing, covering a monthly living expense like an electricity bill, or with furnishing household items in support of reunification efforts. Lastly, the importance in conducting a thorough family finding search in assuring children are placed with kin whenever possible, which can make reunification easier or more likely if children are placed in stranger foster care. This can lead to a potential placement changes, which in turn leads to an increase in children's behavioral and emotional issues, prolonging reunification, due to parents needing to demonstrate additional parenting skills and potentially affecting their ability to meet the ASFA timeline. In my current role as family engagement liaison, my focus is in searching and engaging these family members, both locally and internationally, and bringing them together via a family group conference, in facilitating the family in arriving at a family plan in support of reunification and placement issues. Thank you.
Thank you, Maria, for sharing your insight into some of the barriers that Hispanic families may face when striving to reunify with their children and comply with their court-mandated case plans. It is clear that culturally specific communities' resources and supports need to be present.
Correct.
Our second panelist is Astrid Warke. Astrid Warke is Director of the Human Services Initiative at the Migration Policy Institute. Her research interests include immigrant children and families, health and human services, equity, and leadership development. Ms. Warke has held several leadership positions as she previously founded and directed the Refugee Health Divisions at both the Federal Office of Refugee Resettlement and the United States Committee for Refugees and Immigrants. Astrid, gleaning from your professional experience and the foundational work of Migration Policy Institute, what best practices are recommended for child welfare systems serving families at the intersection of immigration and child welfare?
Yes, I'll be happy to respond to that, Erin, and thank you and everyone involved for hosting this important conversation. So child welfare agencies can implement a range of best practices for serving families at the intersection of immigration and child welfare. And it's important to do so for the very reasons that you, Erin, and Maria outlined, that is to preserve the family unit when it's safe to do so, and to build trust with the family, which will pay dividends when delivering other related child welfare services. So the best practices each agency chooses may, at least in part, depend on the demographic profile of its service population, the resources available, and the promising practices that agency may already have in place. For child welfare agencies at earlier stages of this, I'd recommend best practices that are low-hanging fruits. For example, ensuring policies and practices are in place to facilitate language access. A lot of times this will mean having Spanish-speaking staff and providing forms in Spanish, but language access, excuse me, should really be tailored to data about the languages spoken by the child welfare agency service population. And sometimes that will mean Indigenous languages or even languages associated with African and Asian countries. As another example, a child welfare agency just starting out in this area might want to provide caseworkers with training on basic immigration issues and terminology, such as the different legal statuses. They may also want to designate a resource for caseworkers to partner with on immigration issues in child welfare cases. This could, of course, be a direct hire with specialized knowledge and skills, but it could also be a partnership with another organization. And then as a fourth example of low-hanging fruit, child welfare agencies should offer clear confidentiality policies concerning information sharing with federal immigration agencies, and then guide caseworkers on those policies and review them with the families up front so the families can make informed decisions. And then for those child welfare agencies with existing experience in this area, they might want to consider more advanced policies and practices, and I'll give 4 examples of such. One is to have a designated resource to facilitate international placements when a parent or guardian lives abroad, including if they were deported. On a similar note, child welfare agencies serving a significant number of children from a certain country or a certain select number of countries, for example, like Mexico, they may want to enter into a memorandum of understanding with that other country to facilitate international placements rather than reinventing the wheel again and again with each new case. As a second example of more advanced policies and practices, child welfare agencies could screen children and their caregivers for immigration benefits such as humanitarian protection, relief from deportation, and even naturalization. Like other recommendations, this can be done in-house, contracted out, or through a partnership with another organization. Thirdly, agencies can communicate with the Immigration and Customs Enforcement Field Office staff to provide opportunities to integrate the detained parent with the child's child welfare case, and also to maintain the bond between the parent and the child. And then finally, as a last example of more advanced opportunities to work in this area, child welfare agencies can consider reviewing their policies and practices to allow for formal or licensed kinship care, as Maria noted earlier. And this way, non-citizen family members who are already in the US could provide an opportunity for permanence for the child. By reviewing their policies and practices, they may be able to identify barriers that aren't necessary or could otherwise be addressed. So the main takeaway here is that any child welfare agency serving children and immigrant families, Hispanic and or otherwise, can take steps that fit in its context and better supports the specialized needs of the child and their family. I think of it as addressing the needs of any family involved in multiple systems. In child welfare and social systems more broadly, we're accustomed to cases that involve, for example, mental health, substance use, criminal justice, health, schools, or any number of systems. For a growing number of families, the immigration system is one to add to that list. We work with those systems in whatever ways we can to keep the child with their family when it's safe to do so.
Thank you, for speaking to best practices for child welfare agencies serving families with immigrant members. Particularly, I am inspired by the way that you speak on the immigration system being an additional system that families are not only encountering, but needing extra culturally specific supports. Our third panelist today is Megan Fino Velasquez. Megan Fino Velasquez is an associate professor and director of the Center on Immigration and Child Welfare in the School of Social Work at New Mexico State University. Dr. Fino Velasquez has spent the past 15 years working at the intersection of child welfare and immigration issues as a child welfare practitioner, administrator, and researcher. In 2019, Dr. Fino Velasquez was appointed Director of Immigration Affairs for the New Mexico Children, Youth, and Families Department, where she is building an immigration unit to improve policies and practices to support immigrant and refugee children along the Mexico border and throughout the state. Megan, what models exist for integrating immigration-related legal aid and child welfare practice?
Thank you so much for that question, Erin, and for allowing me to be here to speak about this topic. At the Center on Immigration and Child Welfare at New Mexico State University, we conduct research and develop resources and provide trainings and technical assistance to child welfare agencies on immigration issues. And we have some resources available on this topic on our website if there is further interest, but I am happy to very briefly discuss some of the models that exist for providing legal services around the country in this context. For example, so I'll talk about three models that differ a little bit, and then I'll talk about the newer model that we have in New Mexico. I'll start with Los Angeles County in California that has the oldest model for providing legal services to immigrant children in the child welfare system in the country. Their Special Immigrant Juvenile Status Unit began providing legal services to children in 1991. And the way that that unit functions currently is that it's housed within their Department of Child and Family Services. And they have a unit of eligibility workers who receive referrals from child welfare caseworkers on particular cases, on particular children in cases. They screen for eligibility for legal relief, and then those children are referred to a contract attorney for the filing of special immigrant juvenile status, or to pro bono attorneys for the filings of other kinds of humanitarian relief that include U visas, T visas, VAWA asylum, and DACA, for children and for parents or other family members that may be part of a case. New York City, ACS, the Administration for Children and Families, has somewhat of a different model. Their procedure guides their Immigrant Services and Language Affairs program that began in 2013. The Immigration Services for Youth in Care program, it contracts with foster care providers as opposed to offering those services in-house. So legal services are coordinated by their Immigrant Services for Youth in Care program. between ACS divisions, ACS contracted foster care agencies, and dedicated New York City immigration legal service providers who represent children free of charge. Assistance is provided to children who are undocumented and who are eligible for SIJS or other forms of humanitarian relief, as well as children whose green cards may have expired or been lost, or who might need an extension or replacement. And also to youth who are green card holders, but may now meet the criteria to become US citizens. So for immigrant families involved with ACS in New York, but do not have a child in foster care, this unit also provides guidance to their caseworkers on how to connect the families with citywide resources that offer immigration legal assistance. The third model I'm going to talk about is in New Jersey. This is a unique model because the Child Welfare Agency partners with a public university to serve children in care who are immigrants. So the New Jersey department has an immigration legal specialist in-house, and that person oversees a memorandum of agreement with Rutgers University Law School to provide immigration legal services to children who are in the custody of New Jersey's Child Welfare Agency. So the unit involves 2 law professors and attorneys who screen and file for immigration relief and represent children in immigration court proceedings. And their cases of potentially eligible children are referred to Rutgers directly by casework staff. The New Jersey Immigration Legal Specialist trains local offices so that everyone's aware of the memorandum of agreement and knows when to refer. And the last model I'm going to mention is here in New Mexico. We started a new unit here in 2019 that has created multiple methods for identifying potential immigrant children and youth and their families who may be eligible for legal assistance. As I serve as the Director of Immigration Affairs and represent immigration interests on our department's executive team and to the public, so I can speak a little more in depth on this particular model. Within our unit, we have an immigration attorney on staff with the state, as well as 2 other immigration specialists, one who specializes in child protective services and child welfare issues, and then the other who specializes actually in juvenile justice issues. A key challenge for all of these models is to accurately identify when a child or youth or a parent is a non-citizen and may need legal assistance, because that information in the beginning of a child welfare case is not often known. So as with all of the models, ongoing training and support of case staff is key. And so that's one of the things that we focus on here in New Mexico. And our immigration attorney and our immigration specialists provide ongoing assistance to our caseworkers on all of our cases that involve immigrants throughout monthly staffings, and are constantly updating and assessing immigration consequences based on what's currently happening in a case. We provide screenings for children and parent members for legal relief, including trafficking screenings, and we report potential victims of trafficking to the Office of Trafficking in Persons and obtain benefits for them when able. And on a case-by-case basis, our attorney directly represents our children in care to obtain humanitarian relief and legal permanent residency. As with some of the other models, we also contract with the local legal services provider and refer cases to that provider free of charge to children if we are unable to represent the child. For other family members and for parents and cases where children are not in CYFD custody, our attorney often provides families with free legal consults to assess their situations and whether someone in their family may qualify for relief, and makes appropriate referrals to our local network of legal providers. So these are just some examples of how legal services may be integrated into child welfare systems and may be provided to children and their families to help immigrant family members gain legal permanency in addition to other forms of permanency through the child welfare system.
Megan, thank you so much for highlighting not only the existing models, but the ideas and the approaches that these models take in integrating immigration-related legal aid into child welfare practice. So at this point in our program, I'm going to begin the question and answer session. I will start off by asking the first couple of questions and then open it up to the audience. Please feel free to engage with any of the panelists, and remember to direct each of your questions to a specific speaker in the format of a question for the sake of time. So I'd like to circle back to Maria, if we can, and I'd like to take another look at language access, because this was something that was referenced by you, Maria, during your opening remarks. What are some of the barriers that Hispanic families may face with language access, and maybe not only Hispanic families, but families in general who speak a language other than English?
Well, basically it comes down to the agencies or the caseworkers' ability to assess, first of all, some is their language, because sometimes we assume that all families, for one thing, are Spanish speaking, but that our Latino families or Hispanic, it's very diverse, and sometimes we really look at them and assume, and it might be that they speak a certain dialect, or and that we might have to work a little harder with our community partners to find the appropriate service providers who can best serve them, or look for translation services, professional translation services, to assure that they are able to express their needs and fully, and so that the best decisions can be made and the best case plan can be provided. Because again, that becomes a huge barrier, along with just, again, making sure that the right caseworkers are assigned, or the workers who are competent in that language to be assigned to that family to best serve them and assure their well-being.
I appreciate you bringing forward this idea of a bicultural social worker, or someone who is not only aware of the language, but also of the culture. That
Correct.
Seems to be very important. I want to give both Megan and Essay a chance to answer this prompt, but I turn to you, Essay, just because you spent some time, and I really liked the metaphor that you gave of low-hanging fruit. Because there are some basic steps that child welfare agencies can take that are more culturally competent. But then we know that there's a lot more that can be done. So what can you speak to as far as language access that can be done by child welfare agencies?
Yeah, I think Maria answered it very well. And just building off of her response, I would say that in order to achieve language access, there's an opportunity to hire from within the communities that you serve, right? So recognizing the language skills and the cultural competence as assets, professional assets that can be leveraged by the child welfare agency. And doing so, of course, with confidentiality built into the relationship of the new hires, and that will help to facilitate even greater trust, which is needed to deal with such sensitive family issues.
Excellent. I appreciate you speaking to the need to not only recruit, but obtain a diverse workforce that is reflective of the community. That's very important. Megan, would you like to chime in on this issue of language access in the systems level?
Well, I think the only thing that I would highlight was pretty much covered by Essay in her first set of comments is really essentially that all child welfare agencies should have written language access plans that comply with national class standards. All staff should have access to oral interpretation by phone, ideally in person, and should have a document translation services. And I think in terms of, from a systems perspective, agencies should be completing analyses to understand the most common languages needed in their communities and the most common languages used by their clients, and because that's needed in order to build staffing capacity. And through that, I think in terms of being able to hire the most qualified bilingual, bicultural staff for agencies, I think it's also important as part of a language access plan to be able to provide meaningful pay differentials for bilingual staff and provide ongoing language interpretation training if that's something that's part of the job description in order to support staff in doing this very important work. And also, even though a lot of the low-hanging fruit, as was mentioned, is to understand what are the most commonly spoken languages, is that we also need to make sure that agencies have plans for communication in the less common languages when they do arise and when they do come up, because those often provide lots of complications in cases where you don't want to be scrambling to figure out how somebody can be communicating with a family in these very sensitive situations. And then finally, the only other point that I had thought of was just ensuring that websites are also fully accessible in multiple languages. So much of how we communicate, and even child welfare agencies communicate now, is through online and through the web. And I think a lot of agencies have space to improve language access on their online communications. So.
That's an excellent point, because, especially in light of the pandemic, everything has shifted to, if not already, it has now shifted to an online landscape. And so I think it's important to remember that, and to remember that people need to be able to access things in their primary language. Essay, I would like to ask for your help in framing this next part of our conversation. I know that when I say the term child welfare agency, it can be kind of confusing because there are state and local entities that are considered child welfare agencies. And I wanted to know, just from your perspective, how can child welfare agencies better communicate across states with regard to what we're speaking of today? And then I'll also give Maria and Megan a chance to answer.
Yes. So I should note, earlier on in my career, for about 7 years, I was a mental health therapist working largely with children in the child welfare system, and in Philadelphia, Pennsylvania, and Virginia. And so this idea of communicating across states is very important for peer-to-peer learning. And I know that many child welfare agencies are part of professional associations and coalitions and other platforms where this topic of the intersection of immigration and child welfare can be added on as a critical subtopic of child welfare. In addition to that, I would note that there's opportunities to just make relationships with other child welfare administrators if they don't already exist. And in the report that the Migration Policy Institute published a couple of years ago, we identify several states, including California, Connecticut, Texas, New York, New Mexico, and New Jersey, and several others that have already done a lot of work in this area. So a good first step to take would be to reach out to counterparts in these and other states and ask about what they've learned and how they did it, to see what could be replicated or even scaled up in a given state.
Thank you. Thank you for bringing up the term replicate, because for this conversation, in many ways, I think it's important to highlight what is working and how can it be replicated. Maria, do you have some feedback on how child welfare agencies can better communicate with one another, either within the state or between states?
Well, you know what, Erin, I was thinking more around the issue that comes up when children are in fact removed and they're looking to place kin. I think that an issue that comes up that is so important is in the area of searching for family outside of a given state, and really working with other state agencies or child welfare agencies around when we locate family, in supporting their ability to assess them, to be able to consider that family for a possible placement. So I know that things are in place with interstate compacts between child welfare agencies within each state, but again, working more closely and also more so around the barriers that do exist when relatives are found in another state and they ask for interstate compact. The issue becomes that in some, even though it's not a federal requirement to verify immigration status of relatives, that sometimes that does come up, that some states, is something that I have read, that 20 states do impose citizenship and residency requirements on all applicants, leading to a kin placement. And so somehow working to see how we can in fact work a little better to provide these relatives with the opportunity to be considered for kin placements, to avoid these children being placed in stranger foster homes and being kept within their kin, within families.
I think that the goal obviously is to maintain the family unit, because we know that children are best supported that way. And I think that you're speaking a lot to the importance of interagency compacts for finding family members next to kin, because we know that could be the very next best option. So
Correct.
Thank you for sharing that. And Megan, if you could just maybe help by rounding out the conversation with this question of just, I guess, child welfare agencies communicating between states or between jurisdictions.
Yeah, I think it really, in order to increase communication and exchange of ideas and information on immigration issues specifically, I do think it has to be more intentional at the federal level, potentially creating networking opportunities, maybe through models that are similar to national resource centers. At the Center on Immigration and Child Welfare, we're attempting to do that. We have a practice network, and we host quarterly calls to share information and exchange ideas and questions around immigration issues. And right now we have about 12 states, many of those whom Ase mentioned, and 6 California counties as well that are part of our network. And I also think, and this may not be a very popular opinion, but I think partly it has to do with creating a change in culture. As Maria mentioned, some of the challenges that there may be in interstate compacts, or in how different states manage relative placements with immigrants. Child welfare systems have a long history of being closed systems, given the nature of their work, confidentiality issues, sensitivity of cases. And I sometimes think there's not necessarily a culture of sharing experiences, partly because of fear of public scrutiny and fear of litigation, and not wanting to potentially expose weaknesses. And so they may take kind of the easiest way out, or this is how we've always done things. And I think to effectively address immigration issues across a lot of these agencies, it doesn't actually have to be costly. Our center, our network, has existed for over 15 years and can provide consultation and technical assistance to any jurisdiction that's interested in developing a cost-effective model of their own. And I would say that in creating successful models, it really takes the administrative commitment and usually a champion of the cause to create more understanding about why creating internal expertise is so important, and how we may be able to use our partner child welfare agencies in other states to help us in this process.
Thank you, Megan, for highlighting that technical assistance that is being provided by the Center for Immigration and Child Welfare. Thank you for highlighting that. Before I move to a question that we have from the audience, I would like to ask a follow-up question, just because I want to be mindful of who our audience is today. So we have, a plethora of folks that are signed on, and one of those being policymakers and staffers, people who think about social problems from a federal context. And so I'd like for us to take a moment to speak to how federal policy can be better informed to maybe help facilitate these partnerships, help facilitate this conversation. And so I would like to open it up at this point. So if anyone would like to take it from here, Ase, Maria, Megan.
Sure, I can start. For good and bad reasons, a lot of us as professionals are driven by what is measured. Maybe I should say as humans, we're driven by what is measured. And so at the federal level, the outcomes that are tracked for child welfare agencies to be considered successful really, to my knowledge, don't address language and cultural competence. And I think that's an area where the federal government can show leadership, so that even though people who speak non-English languages may be the minority in the overall universe of children in foster care, they are a very important group. And there should be some accountability to ensure that child welfare agencies are meeting their language and cultural competence needs.
Ase, so if I understand you correctly, almost as, for lack of a better word, almost an accountability.
Mm-hmm.
Okay. Thank you for sharing that. That's an interesting perspective. Maria, I turn to you. Do you have any feedback on what rulemakers, policymakers, those who are thinking about this at the federal level, what should they keep in mind at this time?
Well, Megan brought Essay brought a wonderful point. That point was very, it's a very strong position that I hold. And the other, I think it's again, putting a more focus on the ongoing need for, at the community level, just services, supportive services, culturally supportive services in communities, to better, for families to have better access, more prevention, in hopes of, preventing children and families coming into the system.
Thank you. And I think that prevention has been somewhat of the model recently, how we approach care.
Mm-hmm. Sort of how we're now moving into, even from Casey, there's a good, a strong focus is given and will be given more on prevention. Yes.
And Megan, speaking to the audience of policymakers and those who think about this within a federal context, what can they keep in mind when we're thinking about the problem and how to better support child welfare agencies across states?
Yeah, thank you. I've thought about this a lot, and I think just to jump on Essay's original thought around we pay attention to what we measure. Another part of I think what child welfare agencies need to better understand is who their population is. And so in addition to having measuring outcomes around language and cultural competence, I do think that we need to prioritize in some very sensitive way the collection of data and tracking of immigration related data points specifically, but along with that, ensure to create data confidentiality protections in policy that prohibit data sharing with other agencies for the purposes of things like immigration monitoring and enforcement. So that's one particular area. I also know that from the child welfare perspective, we should be requiring of all agencies the screening and referral for legal relief for all children and parents in our systems, as that is a key form of legal permanency for any child and family who may have immigration issues. And then I think we can look at some state model policies when thinking about how to implement better federally better practices at the federal level, looking at, for example, SB 1064 in California, which was enacted in 2012, is called the Reuniting Immigrant Families Act, which basically states that reasonable efforts to reunification must be made in light of barriers that a detained or deported parent may face in accessing services, so that it requires reasonable efforts in the face of detention and deportation, which are often at odds in terms of child welfare mandatory timelines for reunification. It adds immigration-related issues to the list of compelling reasons for which a court can extend the period of family reunification beyond the traditional child welfare timelines that exist in federal law. It ensures the equal treatment of all relatives as potential resource parents, regardless of immigration status. As my colleagues mentioned, there's a lot of variability across states currently in state laws on how that works. And SB 1064 also requires child welfare agencies to assist children to apply for immigration legal relief. And then it also provides guidance on establishing memorandums of understanding with appropriate foreign consulates in juvenile courts, where typically parents are arrested, detained, and deported. So, simply a model like this that's been enacted in California would be really useful to serve as a model around the country as well.
The California model that you're referencing is very interesting, and I'm sure that we'll have a lot of people looking into that following our conversation. I'd like to turn now to a question from the audience, and I'm going to direct this question to Asay to start, because I think it references something that you've spoken on recently. The question is, what needs to be addressed to improve the pipeline for recruiting a diverse workforce within child welfare?
Yes, so one of the areas I focus on is diversity, equity, and inclusion, and the question about recruiting people with certain backgrounds often comes up in that context. And again, here, I think there's a multi-layered approach that I would advise others to take. One is the pipeline, as the questioner pointed out. So that means starting young, when students are in high school, in college, in grad school, giving them exposure to the child welfare system, to the issues, to research, so that they can find out if that is a career area that they want to explore further. But I think the pipeline is not sufficient. I think it's equally as important to recruit senior level positions within child welfare agencies that have these lived experiences and have these diverse backgrounds, so that they can influence not only the service delivery, as more junior staff might do, but also the policies and practices of a child welfare agency.
Thank you for that. And once again, diversity and equity in the hiring practices needs to occur. And I think that in a perfect scenario, we would see that across all systems. However, I know we're always moving toward a more perfect system, right? So I think that that's a good thing to highlight. Maria, do you have feedback on the question of what is needed to recruit people like you, people with a diverse background, who are bicultural, who understand to understand some of these issues that families are facing?
Well, I think first of all, it just has to come, the an agency has to really place some value, importance and value in this, because it is very, it's very essential in truly being able to serve these families and in moving them through the process of reunification or legal permanency. So I feel like, there has to be a concerted effort and a will and a desire to really to recruit, to be more actively in search of such workers, and as my colleagues have voiced, more so would also have some lived experiences working directly with families and again, just having that value and investing time and energy into this, because it's truly is critical for families to have access to a bilingual, bicultural worker to work side by side with them, because again, they're more aware of barriers that these families face and the needs that they have in making use of the services that are out there in the community. And I can think of, in particular, of a case in which if I had not been assigned to this family, this family was in need of, also had there was some legal issues involved as far as with immigration. I mean, the family, they were undocumented, but because of the nature of the abuse that happened for this child, the family was able to qualify for a VA UV visa. Am I getting it right? They were victims of a crime. And even though I reached out to the county social worker, it just appeared like no one else was really going to take this position on, to take this family through all the steps in the community to access this legal status that this family could very well qualified for and could obtain. It was like, I felt like a one-man show, trying to navigate the systems myself and trying to learn how to go about it. But, fortunately, after a few years, this family is now able to be here legally through this, this effort of mine. But it's needed. It truly is an important item to consider, of recruiting and maintaining and supporting these workers.
I think that thank you, Maria. I think that you're speaking also to the need for these workers, not only for the family and connecting them to the community resources, but I think that there's a need just even due to the high caseloads that so many child welfare agencies have. They're not able to dedicate the necessary time and resources per case as needed. And so that's another area within policy that could be assessed and evaluated as far as, what is the average caseload? I know that numbers will look different compared to jurisdictions, but you mentioned that your work, you carry a caseload of under 20.
Under 12.
Under 12.
So it's 12. And yes, so that has, because again, in San Diego, we do have a small component of ours that is, we provide treatment foster care. Some of the cap has been placed at 12, which does permit us to do that extra legwork, that's required, because it does require, for my colleagues might be very well aware of the fact that, yes, when you work with a Latino family, Hispanic family, you are going to need to devote some time, a considerable amount of time to really help them understand and sort of walk with them, in this process. And when jurisdictional workers are carrying caseloads of 20 plus cases, it does become very difficult for them to provide that same amount of support and services. And so that is how some of these families that are identified and are referred to us, that is one of the reasons, is because the workers realize that they can't devote the time that this family is in need of in order to be successful in reunifying with their child. So by referring them to our agency, and we were able to take that case on, we're able to devote that time that, again, that family would lose out on and probably not be as successful in reunifying had that not been the case in us taking that case on.
Thank you, Maria, for speaking to that. Before I ask the last question of the group, I want to ask Megan, just as follow-up, if you have some feedback about the need of recruiting and retaining bicultural diverse workforce, and maybe what needs to be addressed there.
Yeah, thank you. I don't have much to add, just to reflect and point out that I believe Maria's comments are critical to retention, that retention of the entire child welfare workforce is a huge issue, and caseloads are a huge issue. And in addition, as an educator and as a higher education educator, I do think that the pipeline needs to begin long before college. And as SA mentioned, exposure, providing students exposure to this kind of work and the kind of person that it takes to do this kind of work, and the meaning behind this work, and the kind of help that you can actually provide, and the difference you can make in a family's life. And in addition to exposure, providing students the resources to conduct the work through practicum, placements, or internships to gain the skills necessary, and then also to provide ongoing mentorship. So even as people enter the workforce, thrown oftentimes kind of into the deep end of the water, providing ongoing mentorship and supervision for working with specific families, specific kinds of families, culturally diverse families, Spanish-speaking families, and creating supports for the workforce as they're working with specific populations.
Thank you very much for speaking to that. And I'd like to once again just remind us of our audience. I know that we're in this virtual space, and the audience being those people that think about this at a federal policy level. And I say that to ask my final question of the group, which is, if you could communicate one thing from today's briefing of importance, what would you communicate? And I'd like to have Asay start us off.
Sure. Thank you, Erin. It's been a wonderful conversation, by the way. So my final thought on this is, let's keep in mind, there are over 18 million children in immigrant families, and 5 million of them have at least one parent without authorized immigration status. Figuring out ways to address issues at the intersection of immigration and child welfare, like the best practices I discussed earlier and my co-panelists did as well, has the potential to spare children from the trauma of unnecessary separation. And at the same time, to meet our stated goals and objectives around child welfare, including preventing separation, facilitating safe reunification, and increasing permanency.
Thank you. Thank you. Maria, if there was one thing that you would like the audience to take from today's panel.
I was thinking of this, and I just wanted to leave you all, maybe say, with the vision that I have for what, what it could look like for our families and child welfare. And that is that if I'd like to see a future where out-of-home care is only limited to a small number of Hispanic children who need child protection, and a large number of children and families being served through a robust community response of culturally responsive preventative family support services that are aimed at strengthening the family and meeting their overall needs. That's where I just felt that, again, I think that with time, if more supports can be given at the local level, within communities and strengthening those communities, that will in fact lead to less of our children being identified, because a lot of them, there's a lot of reporting that happens within this population, and some of it is having to do with poverty issues, not so much sometimes neglect or abuse. Not to say that there are abuse, there are situations that do warrant intervention, but that a lot of this could be ameliorated. But keeping in mind what we talked about as far as, that families sometimes out of fear of legal repercussions because of being here undocumented, fear accessing those services, or basically are unaware of them. And so the hopes is that with time that communities can sort of come together and more support services can be provided, and also, like Megan had added, that that certain information is kept out of that, but that fear that if they come in and obtain these services, that there is not that connection to, say, ICE or some legal entity that prevents them from actually accessing those services.
Thank you, Maria. Megan, if you could help close our conversation today with one thing that you would like for the audience to take away from today's conversation.
Yeah, thank you so much. This has been a really fascinating conversation. I can talk about these things all day. When Hispanic families have immigration-related issues, their child welfare cases become increasingly complicated and require specialized guidance for navigating the system, providing equitable opportunities for families to reunify and to remain connected. And there is so much opportunity at the federal level to create additional guidelines and policies to support state and local jurisdictions to improve their supports and practices in this area, and to help reduce variation across states that we talked about. The variation in how immigration issues are addressed in many cases that are currently to the harm and detriment of children and families. And they can address major gaps in services and supports for Hispanic families in the majority of the US. And there are existing local and state models that can be tapped to help provide guidance for this work at the federal level. I think it's there.
Thank you, Megan. And so in closing, today, we've acknowledged the unique barriers that some Hispanic families face when striving to reunify with their children. And in today's conversation, we focused on ways to mitigate barriers and integrate legal services into child welfare practice. So as we become more aware of existing models of legal and child welfare practice, I challenge the audience to consider federal policy responses to the barriers families with immigrant members face. I commission child welfare systems to replicate what works and continue collaboration across state lines and throughout the country. Thank you all for attending today's important discussion.